All right, today I will be presenting my case study. So to start out, a little bit of background. The patient's name was Jenny F. Jenny F. was a 38-year-old Caucasian female. She was married for 15 years with 3 kids, ages 7, 10, and 12. Jenny F. came to the ER for recurrent vomiting, diarrhea, and lower abdominal pain. When asked about her symptoms, she stated they had started 3 hours prior to coming in. She was asked about her day. She was at work. She works full-time at a dentist office. On her way to work, she drank a coffee for breakfast and left work once for her lunch break to go to the local deli where she got a turkey sandwich and a bag of chips. Jenny is healthy. She does have hyperthyroidism, which is controlled with medication and her yearly appointments. Here is a picture of Jenny. She is having her symptoms, which are causing her to be laying like this in an uncomfortable position. Do we have any guesses on what she might have?
No.
All right, so to determine her diagnoses, the doctor ordered some lab testing. First was blood work done because she has a current condition, which is her hyperthyroidism. So they wanted to be able to rule that out or see if her thyroid was acting up and her medication was not working. For her blood test, the TSH level was looked at and it came back as a 2.1, which is within the normal range. Her T3 level was looked at. It came back as a 29, which was within the normal range. Her T4 level was looked at, which came back 5.9, which was within the normal range. And her thyroid antibody levels were checked, which were 12, which was within the normal range. The doctor then ruled out her thyroid as causing her symptoms for today. Next, a stool sample was taken. Stool samples can determine if any bacteria, virus, or parasite is present. There are hundreds of different bacteria that can be causing Jenny's symptoms. One includes Salmonella. So her stool sample came back and it appeared that she had Staphylococcus aureus was found in her stool sample. The doctor also questioned Jenny about if anybody else was sick. If this was a viral infection, she could have gotten it from family or coworkers or anyone she had came in contact with. Jenny stated that that none of her family members were sick or her coworkers that she knew of. All right, so here is a picture of one of the tests done. This would be the blood work for her thyroid levels. Many different test tubes of blood are taken because for her thyroid levels, there are many different things that need to be tested for it. All right, so any guesses after seeing her lab results? All right, so the diagnosis is staphylococcal food poisoning. The doctor explained to Jenny that it could possibly have came from the deli because her symptoms occurred right shortly after eating from the deli. About 25% of people have this bacteria on their skin and in their nose, and it does not cause a side effect for most people unless when it is on food and the food is contaminated, it causes toxins. And then the food contaminated may not look or smell bad, so you may not know you're even eating contaminated food. And here is a picture of the bacteria. For the treatment, the doctor had given her IV fluids during her hospital stay. She was severely dehydrated due to the diarrhea and vomiting. The doctor also prescribed her Zofran 4 milligrams for her nausea and vomiting. So this disease, there is no medications that treat her symptoms. So the Zofran is the only thing that can help. The disease is self-limiting. Toxins causing the symptoms will eventually all be eliminated through diarrhea or vomiting, and then the symptoms usually only last 24 hours. The doctor recommended to her to drink plenty of fluids, as this helps keep her hydrated so her symptoms don't worsen. The outcome, Jenny was discharged once her fluid and electrolyte levels were back up. Jenny's symptoms persisted for 14 hours after discharge, which was understandable. Jenny ended up okay. The next day, her doctor called to do a checkup on her, and her symptoms were completely gone. The health department was also notified to test the employees and food at the deli Jenny had ate at. The doctor explained to Jenny that one of the workers could possibly have contaminated the food, and the toxins could have grown on the food because if it was left out and not at the proper temperature. And in conclusion, Jenny, the 38-year-old Caucasian female, came to the ER of sudden and recurrent episodes of diarrhea, vomiting, and lower abdominal pain. Jenny has hyperthyroidism, which is controlled with medication. Jenny's day leading up to her symptoms had only consisted of work and going to the deli. At the hospital, blood tests were ordered to determine her thyroid levels, and a stool sample was ordered. The doctor found Staphylococcus aureus in her stool. Jenny was diagnosed with staphylococcal food poisoning and sent home after being given IV fluids and Zofran.